And now we're pretty much done with this topic, so let's recap. IAAA, identification, authentication, authorization, and accountability. The identification is my username, my user ID, my employee ID, my name. I am Thor. Now that I claim I am Thor, now I need to prove it. That is the authentication. Here, we can do type 1, 2, or 3 authentication. Type 1 is something you know or a knowledge factor. Type 2 is something you have or a possession factor. Type 3 is something you are or biometrics. We want, on most things, multi-factor authentication. That most often means type 1 and type 2, but there are definitely scenarios where type 3 makes sense. Type 1 is the cheapest, it is the easiest to compromise, and it is the most widely used. Type 3 is most expensive, it has some unique challenges, and it is the only one we can't reissue. We can, of course, give you a new username and a password, we can give you a new passport, we can give you a new ID card, but we cannot replace your fingerprints. At least not that I am aware of. Then we talked about least privilege. We give the user exactly enough to do what they need to do, no more, no less. If they need to do anything outside of that, then we need to grant them more access. And least privilege is often used with mandatory access control. Then we have need to know. You get access to way more than you need to do your day-to-day job, but if you access the data, you have to have a need to know. It needs to be something that you need for your work. This is where if you are the doctor, you can access patient data for the patients you're treating. You can't just go browsing around and looking at patient files. Then we talked about discretionary access control. That is at the discretion of the owner. They can grant and remove rights. We talked about mandatory access control. That's the one where confidentiality is most important. We use least privilege, we use labels and clearance. Objects have labels assigned to them and subjects have clearance. That clearance needs to supersede the label assigned to the object for you to access it. Then we talked about role-based access control, by far the most common type of access control today, and what you're going to see in most corporate environments. Rights are given to a role. That role is then assigned to anyone who has that position. The thing you need to remember here is we need to remove access if someone moves to another group. They get their old rights removed, they get the new rights added. And then as the last major model, we have attribute-based access control. Similar to role-based, but it also has attribute. And this is most likely what we're moving towards. It's much more granular compared to role-based access control because here we have the subjects and the objects, but we also have the environmental conditions. And then within the different types of access control we can also have context-based access control. That's the one where if I log in from my home PC, that IP is whitelisted, I log in within working hours, I get access. But if I log in from an entirely different country at 3 in the morning, I don't. Then we have content-based access control. Based on who I am, if I'm a doctor, I get one menu. If I'm a pharmacist, I get another. And then as the last part of the IAAA model, we talked about accountability, which can sometimes also be called auditing. We trace an action to a subject's identity. If someone logs in on my PC using my username and password, using my token for multi-factor authentication during working hours while I should be at the PC and delete files or steal proprietary information, it's going to be very hard for me to say I didn't do it, which is non-repudiation. I can't repute having done that. And with that, we are done with this lecture. I hope this has helped you get a better understanding of the IAAA model, how we use it, and why we use it. Thank you for being here, and I will see you in the next lecture.